OB-GYN Chats. This is where we have conversations to better inform you, and that's why it's important to like, subscribe, and share the conversations with another friend. My name is Ilka Plant, hosting this episode for today, and I'm joined by, that's Dr. Simon Mvula. Welcome and thank you always.
Hi Ilka, how are you?
Very, very well, and thank you to you and the lovely team that always takes time, and we know you're busy, to have these important conversations.
No, then thank you for always giving us this platform.
You're welcome. So at Lady Pohamba Demashuya Suites, this is where you find the doctors. Thank you for always having this very, very, open environment. How has the year been so far?
No, it's been great so far. I mean, a lot of baby coming up.
Yeah.
A lot of baby who will still be coming. So we're excited, and
Yeah, and it's the month of winter.
And yes. Yeah.
So Doc, when we speak about, the happy news of, childbirth is a beautiful process, but sometimes if some things don't add up, it becomes a bit difficult as well, emotionally and physically. So last year we spoke about fibroids, but I think let's add another discussion on it, but let's set the tone. What are fibroids?
So fibroids, I'm sure like most women have heard the term fibroid, and sometimes one will be wondering is it a cancer, is it not? And it's also, some women doesn't know exactly what fibroids are, but what it entails, it's a non-cancerous tumor, which means it's a growth that grow in the muscle of the womb, usually originate from the muscle of the womb, and it's not a cancer. So, and it can affect the women's fertility, the menstrual flow, or it can also cause pain, which obviously can grow from different sizes. So it grows on a woman's womb, and it's coming from the muscle, which can have effect on periods and also fertility.
So doctor, you said you've got your own uterus.
Yes,
so
I do have my uterus.
To place the conversation into context, let's see the kinds of fibroids, because there are different ones, they're in stages and different places. So maybe let's illustrate where that is.
So I have my uterus here.
Yes.
This is mine. So fibroids, you can get this is the uterus, as you can see, and these are fallopian tubes here, and you get the ovaries. So usually what fibroids, where the fibroid grow, you got the muscle of the womb, and this is the cavity where the baby was supposed to grow, and this is where the periods comes from every month to go into the vagina. So fibroids can either, you can have a fibroid which is hanging out, which is originate from the muscle, but it's hanging out of on the womb. So that one most likely won't have any effect on the woman's fertility, also on the menstrual cycle. You can have a fibroid which is in the muscle of the womb. So now this will depend on the size. If it's a small fibroid which is just in the muscle, it also won't have any effect on the period flow or also on fertility. But you can have one in the muscle, but it's growing to push into the space in this cavity where the baby was supposed to grow, and the same cavity where the menstruation flow comes from. So if it's pushing here, it can definitely affect fertility, and it's also have an effect on periods. And you can also have now one which is hanging into the cavity. Definitely that one, that's the one that it's a very dangerous one when it's hanging in the cavity, because it's associated with excess blood flow, heavy menstrual flow, and the fact that it's hanging in the cavity, implantation can also not take place. In case of pregnancy, it will be difficult to conceive with this fibroid. So the fibroids, the symptoms depend on the location, depend where it's located, and also on the size. Then you can have a fibroid which is out, but it's very, very big in size, so it will push other organs like the bladder and the rectum. Then a woman might pee a lot or will have constipation. But the one that any fibroid that pushes into this cavity here would definitely have an effect on period flow and also on fertility.
Yeah, and I love that doctors showed how it goes. So just to recap some of those warning signs, and I'm just thinking, sometimes women could think it's part of my menstruation, or maybe it's normal to bleed, or maybe it's normal to really have a lot of pains. But what are those alarm red flags to say that maybe you should get tested and see it could be fibroids?
Sometimes a woman can have a fibroid, and especially when it's out of the womb. When it's like hanging out, and they won't have any symptom. So the symptom of the fibroid depends on the size and the location. So if you have a big fibroid which is compressing against all the organs that are close to the uterus, which means it can be the rectum, then they will present with the history of constipation. Or if they have, if it's compressing against the bladder, they will start peeing a lot at night, and the bladder doesn't fill up so quickly because of that pressure. But That's those now if they are very big. But one can have a small fibroid of less than 1 centimeter, and it's in the cavity where the periods flow. They will come with heavy periods. So symptoms can be pressure symptoms, which means they can have pee a lot, constipation. They'll be having heavy menstrual flow, and or they can also present just with bad period pain or just chronic pelvic pain. They're just having pain. Or they will come to us with that I've been struggling to conceive. Because you can have a fibroid which is, let us assume it's not really in the cavity that it can cause the heavy bleeding, but it's pushing toward the fallopian tube, which means it's blocking this fallopian tube. So as much as the periods are not heavy, you won't have any symptoms, but now conception will be difficult because the egg can't go through, and also the sperm is also blocked. So the symptoms can vary, and sometimes it's just an incidental finding. Go for a routine scan and we're like, oh, there's actually a fibroid here.
Yeah.
Yeah.
Prevention is better than cure.
Yeah.
Before we get to the whole issue of, if you do have fibroids, I want to ask, is it genetically inherited? How does a woman get fibroids? Is there a certain way we should look out for? Are there things we should do? Is it the diet? Is it the exercise? Is it consumption of alcohol? Or what
That's a very important question, because whenever you have a medical condition, you always ask, what could I have done to prevent this? And the answer is that there's nothing to do to prevent fibroids, especially when it comes to a woman, because there's a genetic link. In most cases, we know we are dealing with people of African descent. They are more prone to have fibroid than the Caucasians. So because there's a genetic link that make them prone to develop fibroids, and there's literally nothing that you can do to prevent. So it's not a lifestyle disease. It's not like because some people say, no, maybe I should eat healthy. It got nothing to do with the diet. It's not yet scientifically proven that there's anything to do with the diet. It's just genetical links. And ideally, there's nothing that one can do to adjust their lifestyle to reduce the risk of having fibroids.
So it's just best to do your checkups.
Yes, just to do
and make sure,
checkup.
Unless if you have those red flags, alarmed.
Yeah.
When you do the checkup, doc, and you have fibroids, can you, like you said, it might affect fertility?
Yeah.
What is the removal process? What happens once you've given the results?
Okay, so a fibroid that we found incidentally with no symptoms, and especially when it's not pushing on the endometrial cavity where the baby was supposed to go, and a woman who is not struggling to conceive or doesn't have any symptoms, unless it's very big, we don't do anything to it. We just manage it expectantly because it doesn't give any symptoms, and also we know it's not a cancerous tumor, so we don't do anything. The fibroid that we remove or we do treat are those ones that are symptomatic. So a woman who is struggling to conceive and they have fibroid, we remove those fibroids. Someone who is having period pain or they have symptoms of heavy flow, we remove them. Or someone who is also having pressure symptoms, we do remove them. But what I want to emphasize is that there is a lot of advertisement of oil, natural herbs, and all I can say, there's nothing like none of those that are, and we see them a lot of advertisement.
Yeah.
We treat fibroid. There's nothing that is proven scientifically yet that it can really completely prevent you from having fibroid. There were medications that were approved a few years back, but they are found to be affecting the liver. So currently, there's no proper medical management to treat fibroids, apart from doing surgical and or other procedure that we have spoken previously.
That's why it's important. Look at the credible and credited sources where you get the information from. If you have fibroids, like Doc said, sometimes you could be living with it without even knowing the symptoms. If you have fibroids, you've noticed that you had it, you removed it, can it reoccur, or once you get rid of it, it's done? That's
the thing. So unfortunately, if someone has fibroids, especially when they have multiple fibroids, the likelihood of them coming back, even if we remove them, it's high. Because the issue is that there will always be some small one that as a surgeon you might not feel, or you might not, if you do it laparoscopically because you can't feel, you might not see them, then you leave a small one. But it's just there that if we remove fibroid, doesn't mean it will not come back again. When someone is prone to have fibroids, the likelihood of it coming back is high. That's why most of our patients, I always advise them that if the fibroids are asymptomatic, let's remove them when you are planning to conceive. Because if I remove them today, there's no any symptoms, and you are planning to conceive like maybe in the next 5 years, you come back to me again after 5 years, and now when you are ready to conceive, I found that there's another fibroid, then you go through another surgery. So what we try to do is to avoid multiple surgeries. So we say that if there's no symptoms, we manage the fibroid expectantly, unless then when the patient come back and say, no, now I'm trying to conceive and I'm struggling, then we remove the fibroid. Or when we know exactly it's going to have an effect on fertility, then we say whenever you are ready to conceive, you must come, then we remove the fibroid that time. Because the moment we remove it and we are planning to conceive in the next 5 years, we can't guarantee that time there will not be another fibroid that might also require another surgery.
Right.
Yeah.
Doc, I know that at OB-GYN we've also discussed about endometriosis as well. Let's finally just answer the question, what's the biggest difference? Do they have the same symptoms, and how could we separate the two?
They are two completely different medical conditions, because endometriosis is the way it involves the implantation of the inner lining of the womb that implant at other places in the pelvis, in the ovary, in the fallopian tube. Whereas, so endometriosis usually it's not like a mass that grows in the muscle of the womb, unlike the fibroids. So they are two completely different conditions, and their treatment is completely different.
Yeah.
So there's no interlink between endometriosis and fibroid. They are completely different, and they also have different treatment.
Yeah. And the symptoms are the same, or are they different?
Endometriosis is a pain disease. Usually with fibroids, a patient can have fibroid with no pain, but endometriosis is because of this implantation of the inner lining of the womb that implants somewhere else. So when a woman goes on her periods, there is also this microscopic bleed that happens in this area where there is those cells. So they will have so much pain. So endometriosis is classified, is described as a pain disease because it's a bad period pain that can be associated with a chronic pelvic pain. And they are completely different, and also in the way of treatment is also different.
All right.
Yes.
Thank you for setting the record straight, Doc. We appreciate. Next time you'll be back again.
Thank you.
There you have it, Dr. Simon Mbula giving us the factual information, and that's why it's good to consult the experts and not always Google up symptoms, because you might be advised in the wrong way. Meet us again next month. In the meantime, please share the link, subscribe, and share it with someone that really needs to hear this conversation. Until next time, it's goodbye.